New rules took effect on Wednesday for those who are confirmed to have COVID-19 and those who come into close contact with the infected. But the public is confused by frequent changes in isolation rules.
Starting Wednesday, those who are confirmed to have COVID-19 and those who come into close contact with the infected must isolate for 7 days. This applies to everyone regardless of vaccination status or symptoms. Self-isolation begins from the day when a sample is collected. If a person has his or her sample collected on the 1st of the month and was confirmed to have COVID-19 on the 2nd, his or her isolation period lasts until the midnight of the 7th of the month. There is no need to receive a PCR test before isolation is lifted. Rules for close contacts have also changed. From Wednesday, fully vaccinated people who come into close contact with the infected need not self-quarantine. This also applies to family members who are living together with a member that contracted COVID-19. However, those who develop symptoms such as a fever or difficulty breathing should contact their local public health center and get tested. People who have been quarantined should avoid contact with people from high-risk groups 3 days after their isolation requirement is fulfilled and follow daily safety precautions.
확진된 다음에 7일 정도 경과된다고 하더라도 약간의 그 감염 가능성을 다 배제할 수는 없습니다. 다만 그 확률이 상대적으로 매우 낮은 수준이기 때문에 이럴 경우라면 그 모든 격리를 하는 것보다는 마스크를 쓰고.
The unvaccinated who are living with the infected, as well as those from vulnerable facilities, must isolate for the same period as the infected. Vulnerable facilities include nursing hospitals and homes, as well as psychiatric hospitals and facilities for the disabled. They must receive a PCR test prior to having their isolation status lifted. The new guidelines also apply to those whose quarantine began before Wednesday.